My name's Dave Hawkins. I work for ULR, University Health Board. Have done for 40 years. This is now my 41st year. My current position in the organisation is as a senior nurse manager for surgical services in Withybush General Hospital. However, I've currently been seconded probably for the last 8 or 9 months as the Senior Operational Liaison Officer for the fire enforcement works that we're doing currently in the hospital. It's a 4-year multi-million pound project to get the hospital up to scratch with regards to fire safety. So it's a very interesting and diverse job to being a senior nurse manager, but I think with the 40 years experience that I've got, the contacts and people who I know and who knows me makes that liaison by far more robust, to say the least. I've been in the reserves now for 17 years this year as part of 203 Welsh Field Hospital. But I was a reservist back in the early 80s till 1987, when I was a musician and a driver with the Royal Corps of Transport, TAVR as it was known then. And that was something that I wanted to do, which is completely different to being a nurse in training. So I didn't want to be clinical. Back in, I think it was probably around 2005, I was approached then by 203 Field Hospital recruiting team, asking if I would be prepared to join, as at the time I was the organisation's resuscitation and clinical skills training manager. I was also advanced life support, paediatric life support, trauma, and so on and so forth. So I had a skill set that they were trying to see if I would come and support them, particularly because there was a run-up to deploy to Afghanistan. So I joined as a medical support officer. So I didn't join as a QA nurse. And I did all the training for the 2 years with them after being taken to Sandhurst for my initial training, which was absolutely fantastic. And I learned a great deal there. And we deployed as a unit in 2008 on Operic 8, which was probably the most demanding thing I've done in my whole career. I was deployed as a trauma nurse coordinator. So although I wasn't actually in as a nurse, I actually did go out in a nursing position. And it was an extremely challenging position because I worked by myself 24/7. I had to attend all trauma calls. I had to attend all ongoing treatment plans with the patient, care of the deceased, repatriations, etc. So it was quite a busy time in my life, to say the least. From there then, I've promoted through the ranks. I started off as a second lieutenant. When I went to Sandhurst, I'm now a major, and I'm also holding a post as the Healthcare Governance Officer for 203, which is a post in its own right. But also now I'm the Officer Commander Nursing Squadron, which is a senior command position with the unit. And we're about to go into a further transition now where there's going to be changes within the health side of the Army. So good opportunity, great challenge for any new people that we can recruit into our organisation. It's a tremendous rewarding experience being in the reserve. 17 years has probably given me the majority of my clinical experience. I thought I'd done it all. I was a paramedic as well as a registered nurse. I managed the A&E department for several years, and I thought I'd seen it all until I did my first operational tour in Afghanistan, where the trauma in particular was absolutely phenomenal. So I gained a new skill set basically from that time. And again then when I deployed in 2013-14, where it was the drawing down of Afghanistan at that stage, but still quite busy, where I was the officer commander in the emergency department. So again, that gave me another set of skills that was transferable back into the NHS. My job and my organisation is absolutely fantastic. They are very, very supportive and encouraging to people who want to be in the reserve and who want to join the reserve. There are the benefits, obviously, of the extra time off, the leave. So when you do your annual camp, you do get 2 weeks paid leave from the organisation, as well as getting paid by the military at your rank, so it is an incredible bonus. Obviously, transferable skills, being a senior nurse manager in the NHS has allowed me to basically do the roles that I've currently got in the military. But I think the skill set that you learn from the military in regards to the team working, the cohesion, the leadership, control and command, and the general way that the military actually works in regards to those elements of management really, is extremely beneficial to my job in the NHS. So all in all, I have to say it's been a tremendous experience. I'm still in it. I've probably got another 2 to 3 years until I have to leave. And I would plead with anybody, whether you're a clinician, a support worker, or a non-clinical person, to seriously look at taking up a career with the reserve forces, whether that's Army, Navy, or Air Force, because I can assure you, you will get a great deal out of it to support both your ongoing role and for any future developments or promotions that you so wish. So that's me, that's Dave Hawkins, Army Reserve. Thank you very much.